Welcome, everyone. My name is Melissa Braxton. I'm a care service coordinator with ALS United. We are happy to have Mr. Doug Feltman today, who is the founder of Home Helpers of Bergen County and New York City. Doug founded his agency 15 years ago. He was motivated to start his business after caring for his parents with dementia. Doug and his highly trained home helpers have aided many ALS clients and families over the years with considerable success, which he will relate to you later on in his presentation. He is a former Navy SEAL, also a certified public accountant and entrepreneur, and he finds home care the most satisfying of his work experiences. In his spare time, he has been the president of the Fort Lee Regional Chamber of Commerce, an active member of the Rotary Club, and the current president of the Sherman Chamber Ensemble. He remains physically active on a daily basis and is a former professional soccer referee, marathoner, and triathlete. Thank you, Doug, and welcome.
Good morning, everyone. It's a pleasure to be with you all. And I'd like to thank the ALS United Greater New York group for asking me to be with them. I have a long history with them, and I would like to thank Debbie Schlossberg, who 12 years ago offered to come to my office to train my caregivers as we had an important ALS client. And that has lasted all these years, and we know how important it is to properly train our caregivers for ALS. I'd like to just a little housekeeping. Let's hold the question and answers till the end of my presentation, but please put the questions into the chat box as we go. I also asked everyone to do a poll of who actually is attending. Are you an ALS patient? Are you a caregiver of a patient or a professional? And if for those of you who haven't done that, I would appreciate if you would do it now. I'd love to know who I'm speaking to, and maybe I could even change my presentation somewhat as we do it. So let's get started. Today's discussion, I'm going to go over an overview of what non-medical home care services are. When do you want to consider non-medical home care services? Common questions and factors to consider, and how to find a provider. And then we will go on to the Q&A. This picture below you is one of my veteran clients who I worked with for a number of years, a dear man and an inspiration, and someone I will always remember. So let's start with this overview. Non-medical home care refers to services and support provided by a professional caregiver to a client in the place they call home to assist with activities of daily living. And this we're talking about, before we go into that, is when you need help. It could be 4 hours, it could be 8 hours, it could be overnight, it could be live-in. But the types of care we do, companion care, when someone just needs a little bit of help, maybe 4 hours a day to maybe let the spouse go off to do her own things, exercise or go to the grocery store. We come in and we will do the type of companion care that includes grocery shopping. We could go with our client or without. We do meal preparation. This would be working with the client. We often are the sous chef, and we let the client who maybe can't use his hands or his legs at this point direct us in how to cook the food that they're particularly interested in. Our aides do light housekeeping. This includes vacuuming, mopping the floors, cleaning up the kitchen, working in the bedroom, changing the bed linens, but not toilet cleaning. Professional caregivers are certified home health aides, and they are not maids, and they are very adamant about that. But all the lighthouse skiing will be done. They do medication reminders, which I will talk about more later, wellness calls more later, 24-hour monitoring later. We go do local transportation. We take people to, whether it's their doctors, whether they want to do to go to religious sessions or, or activities for the mind and body. We believe very strongly in exercise for anyone, whether they are completely bedbound or not. There are always exercises that can be done for the body. And we work with PT and OT on doing those exercises that are appropriate for our ALS patients. And of course, we believe very much in activities of the mind. And of course, with most ALS patients, that's not really a problem. And we just help them with using their computer, or if they're using eye gaze, we help them with that too. So as I mentioned, we do companion care. However, as mobility changes, the ability to take care of one's own hygiene can be a growing challenge. And additionally, people may be reluctant to get help from their own family due to pride. This is in such things as toileting and showering. And often a spouse will not want to do that, or it's very uncomfortable for both people. And this is where professional caregivers can assist and help to preserve dignity while providing support. I'd like to go in now and tell you a little bit about some of our ALS clients that we've had over the years and how inspirational and upbeat it's been. The first one I want to talk to you about is a woman doctor who hired us when she was in sort of the mid-level stages of ALS, and we took her to her office every day. She obviously couldn't drive, she couldn't walk very well, but we went to the office, she worked with her staff, and we helped her with a lot of her paperwork. We helped her on the computer, and we would do some of the input for them, make sure she had enough to eat and drink during the day, and then we took her home at night. This continued for quite a few months, and until the ALS progressed. After probably about a year, she could no longer really go to the office, but she worked using eye gaze and the computer and still kept active in her practice. And unfortunately, she ended up having to be fed with a feeding tube, and that sort of precipitated her final decline. But our second client we called Judith. She was about a 55-year-old retired teacher who had initial stages of ALS and walked with braces. And she hired us for about 4 hours a day. And we came in to help her with cooking and drive her to the grocery store, and we did all the grocery work. And she was very, very optimistic about her life and continuing to make it work. But as it progressed, we went on to 8 hours a day. And unfortunately, she started running out of money. And we realized that this is not going to last the rest of her lifetime. So we helped get her on Medicaid in New Jersey. And when she got on Medicaid, then she had a lot more help. And it wasn't quite around the clock, but it was enough to really help her and keep her very upbeat. However, we realized we had to start planning for the next step, which would be assisted living. And we learned about the Leonard Florence Center in Chelsea, Massachusetts. And some of you may know about this place. It was started, I guess, 5 or 6 years ago, and it's exclusively for ALS patients and some MS. And it's one of these places that allow you to be semi-independent. Everyone uses eye gaze and their computerized wheelchairs. They're able to travel around between rooms and on floors. They can turn the elevator button through their eye gaze, and they can even drive their motorized vehicles outside. And we decided this would be something that we would like to get Judith into. There was very limited beds, and we had to have an interview. And Judith happened to have a wonderful aide called Maggie, who was well-trained in ALS. And she offered to drive her to Boston to do the interview. The interview went well. And a few days later, we heard that our Judith was accepted at the Leonard Florence Center if we could get Medicaid transferred from New Jersey to Massachusetts. This is obviously a very difficult situation, but we got lawyers and the administrators at Leonard Florence Center and our people in New Jersey. And after a period of time, it miraculously got approved for Medicaid in Massachusetts. So then my aide Maggie packed up Judith and we went up there and she settled her in there. And Judith then became a valued part of the whole community of other ALS patients there and was incredible how independent she could be. I went and visited her one weekend there, and it was one of the great experiences of my life because I could see that even though the disease was progressing, she was still able to do so much independently through eye gaze and through everything, all the computers that were connected to her wheelchair and her life. Judith also had one thing on her bucket list that she never was able to do. She wanted to go skydiving. And believe it or not, the Leonard Florence Center was able to arrange that. And one day, she and a skydiver were attached together and they jumped out of the plane and they did it. And Judith, you can actually watch this on YouTube. That's how great it was. And this was probably the greatest experience of her life. The other client I'd like to talk to you about is named Ken. He was a 45-year-old athlete who was also a civil engineer and probably one of the most optimistic people I ever met. When we first started with him, we were able to give him that same caregiver that was with Judith, Maggie, and Maggie became part of his life and his family. He had a loving wife who was a great caregiver, and he also was a very successful engineer and had an important job in New York City. He immediately started planning for the rest of his life, and first thing he did was to set up his house so that he could operate somewhat independently in the house. It was a 2-story house, and he first installed an elevator. He then had hoists put in his bedroom that was like a Hoyer lift on the ceiling that allowed our caregiver or his wife to put him into a Hoyer type lift strap, and then he was able to direct it himself along the ceiling to either the toilet or to the shower. And at that point, our aide helped him shower and also on the toilet. But he also realized that having a bidet would also be an important thing that would helped his dignity because he could then somewhat be cleaned by the bidet. Some of the other things that he used was he was a computer expert. So for his job, once he learned eye gaze, he was able to set up all kinds of staff meetings on the computer, on Zoom, and conduct his business and some very important architectural projects. He also had a great van, a mobile van that we were able to wheel him into, drive him to New York, to his office, and he would conduct his meetings that he needed there. He also he had a standing wheelchair, which also helped him. He made sure he had a very special hospital bed that moved even more than the front and back that most hospital beds have. And he had an air pressurized mattress, so he never had any bed sores. He tried to maintain his normal life with his family, and they even went on vacations. And he had a portable lift that he could use for hotel visits. He was the kind of optimistic man who looked at every possible ALS research project and clinical trial, and he wanted to be in them because he was still young enough then that he could be in some of them. Unfortunately, as you all know, most of them didn't work. And he finally did pass away, and I attended his funeral, and it was a giant funeral with so many people and so many incredible eulogies that were such an honor for him and such an honor for me to even know him. So let's go on to medication reminders. And this is a tricky one because our aides can use pill boxes or even the automated pill boxes that tell you the time and whether it's morning, lunch, evening to give the medication. And they have to be able to find a way to give it to someone who cannot really use his hands, but it works. The other types of non-medical services we highly recommend are the 24-hour monitoring. We have devices. The one you see here on the right is a mobile unit that is similar to help, I fell down, I can't get up, but you wear it around your neck. It has a very sensitive fall sensor that if you fall, it goes off and it gets sent to a call center where they will call the important people in your family to have them check on you, or last resort, it will go to EMT, will come and get you. The beauty of this is also for those of our ALS clients that can walk, you can take this outside because it has GPS. And the GPS is very accurate and will tell EMT or the other caregiver who may be around to go get him where the location is. It also has an app that you can speak into it. So it's a very useful tool, and we highly recommend it for our ALS patients that are still walking. We also believe in nutrition. There was a very interesting nutrition session on earlier today, and I listened to that, and we can find different types of things that are so important to make sure that clients have built up enough strength to actually live properly. We have two services that we use for those families that either can't prepare their own food or want some additional help. And what they do is they send out frozen, these beautifully prepared meals that can be specialized for low salt or diabetic or Mediterranean health, for healthy food. And they send it frozen. It goes into the freezer and just use the microwave to prepare this beautiful food. And what it is we actually, in my office, we ordered about 10 of these one time, and we all shared all different kinds of meals, and they were incredibly nutritious. So we have two services that we use for this. One is called Silver Cuisine, and it's silvercuisine.com. And we have another one called cleaneatskitchen.com, and that's Clean Eats, ETZ. So it's cleaneatskitchen.com. And they have very inexpensive meals, and it's worth it for some people who would really like to utilize and not have to cook anymore. We also work very closely with hospitals and rehab centers on discharge support. What can sometimes happen is someone is due to be discharged from either a hospital or rehab, and there's no one to pick them up. Sometimes hospitals and rehab centers say, you must be discharged by tomorrow at 11 a.m. And there's not always someone that can come in from far to pick them up. So we have a service where we will come in, we will pick up the patient from the hospital or the rehab, take them home, make sure the refrigerator is clean, and we eliminate all the perishable items that are probably still in the refrigerator. We then will go out to the grocery store, pick up new food for them, pick up any prescriptions that they may have needed to pick up on the way home, and then make sure they're comfortable at home and probably prepare a meal for them. If they actually need aides, well, then we would have aides come in for whatever is needed right at that time. We do wellness calls for those patients who can still live by themselves. We find very often that 1 or 2 calls a day may really help. And we're calling to remind them, have you taken your medication? Are you drinking enough? Did you eat properly? What kind of doctor's appointments do you have coming up? And even just a little basic conversation seems to work, because a lot of people living alone are really lonely. Okay, and then we believe in, as I said earlier, mental health and physical activity. And we love to take our clients out for a ride if they're able. We believe in music and art. We take people to museums. There are a lot of programs for disabled that will take you to a museum and sit you in front of a couple incredible paintings and have a docent explain what it's all about. And sometimes even get the patients involved in doing some pen and ink drawings. Okay, now we get into the really questions. It's as one's care needs increase over time, it may become too much for the family to manage, despite their best of intentions. And a survey was done that of caregivers, and they found that most family caregivers have a tremendous amount of stress, worry, concern about the future, anxiety, sadness and depression, loneliness, and anger. But despite the multitude of challenges they face, helping a family member in need has a positive effect on their lives and brings a sense of purpose and pride. But you still get to that time that maybe you need to consider hiring someone. So what do you look for in a professional caregiver? Obviously, thoroughly background checked, criminal background checks. Have they been checked for elder care abuse? Have their driver's license been checked for DUIs? Are they experienced, well-trained, and insured? I mean, this is important for the any ALS patient. You can't just send somebody in who's maybe taking care of cancer patients. And are they caring and compassionate? This is where an aide is someone who definitely has a passion for the job. It's not just a job. And that's where this comes in. And the other important part is there a personality fit, not only for your loved one, but for you, the caregiver, or the spouse, because you're going to have to be spending significant amount of time together. And if that is the case, you want to be able to get along. We often have questions about, particularly with live-in caregivers, how do you send a live-in caregiver, and what are they going to do as far as working with the whole family? And I asked the question of the family, do you want to have a really chatty caregiver, or are you looking for someone who can be seen but not heard? And that's really the choice to be made, because the wrong choice makes it really difficult for having someone living in your home. Okay, so the other things to consider is you've made a decision now that maybe you're going to have a home care option, and you decide, well, how do I find somebody? And very often I hear the story of, oh, I have a friend who just had an aide, and she was really good, and I would recommend her. So many times this would be a private aide, and private aides are very inexpensive because many times they're illegal in the United States. They don't have social security cards. They may request to be paid by cash. I've heard the story of one a potential client I had who wanted to get rid of her caregiver because she was illegal, and she required my client to go to the bank every week to take out $1,000 in cash to pay the caregiver. Well, this is terrible. I mean, I hate to hear a story like that, but that's the choice you have to make. Do you want professionalism where you have hiring an agency who has done all the background checks, who are accredited and have very high standards of training, and have worked with all kinds of clients? Do you also want to have a caregiver who doesn't have any oversight? Agencies have plans of care for each client that are overseen by nurses. And each day, the caregiver reports on the tasks that they've done and any comments as to whether the client is in good shape or not. And the nurses see these reports right on their computer on a daily basis. And that tells them that they need to react to either visit the client or maybe talk to the caregiver that they're not really doing the plan of care. They also make sure that protocols are set in place for handling emergencies and coordinating with other healthcare providers like PT and OT, which we work with all the time, and then updating the plans as needed. A lot of agencies have plans that we don't automatically send our clients to the emergency room when some emergency seems to happen, but we first contact, there's a service called Dispatch Health that has emergency doctors and nurses that will come out to the home the same day. And if it's not someone who has fallen and broken their hip or leg and needs to go to the emergency room, we will call Dispatch Health to come in to do their own evaluation and prevent an emergency room visit. One of the most other important things to remember too is if you have a private caregiver, what happens when the caregiver gets sick or children get sick? Who's going to substitute? Agencies always have trained substitutes that are available to work with the client. And so that there's that peace of mind. And there's the legal protection. Clients who use in-home care agencies have legal protections in place, such as insurance coverage for accidents or injuries that may occur during caregiving. And for theft, I mean, with Alzheimer's cases, there's a lot of cases of Alzheimer's clients accusing their caregivers or even their family of stealing. And agencies always have insurance in place for that. And agencies always have their own employees so that taxes are withheld. And if they have health insurance, that's given to our caregivers. They're also protected by workers' compensation, which a private caregiver is not. And if they get hurt on the job, the responsibility falls on the family to cover not only their medical expenses, but their salary that they're losing for that time. So getting back into these questions, you're almost ready to speak to your ALS family member that it's maybe time to have home care. And how are they going to react? I mean, they're used to having a family caregiver there, perhaps for a long time. And it's tough to bring somebody else in that they don't know, even though there will be an introduction and an interview, and they will help to choose the person that will be coming in from the agency. The other possibility is we've had situations where the family caregiver has been so totally involved 24 hours a day in this that they consider this a full-time job, and they're not even interested in giving it up, even though it may affect their health by continuing to do this. So you have to really think about how you present this. And then how do I trust someone I don't know with this important responsibility? Well, that's where training comes in. Will the person coming in, do they have enough training in ALS that they can help you as the disease progresses? And then I'm going to skip the home care options till the next slide. But how much does in-home care cost? It's very expensive. And you look at, well, Medicare and Medicaid. Well, Medicare barely pays anything for it. It's something that the government has promised a long time ago to cover home care because it's a lot cheaper for home care than to send somebody to a nursing home, which is often covered by Medicare. Now, Medicaid does cover it. So if your financial situation is such that you have a lower amount of income and assets, and you haven't transferred a lot of your money out in the last 5 or 10 years, I would highly recommend going to a Medicaid elder care attorney and discussing qualifying for Medicaid, because it will pay for this. A lot of our clients are fortunate enough to have purchased long-term care insurance when they were younger. And this often covers all or most of the costs of home care. One of the other things that we talk about for some people that need money when they've run out is a home equity conversion mortgage for seniors, sometimes called reverse mortgage. And that has come under in prior years a very bad connotation because of the high costs of reverse mortgages, but has now been repositioned by HUD so that is not so expensive. And it allows you to take out just as much money from the equity you've built up in your home to pay for home care if that's what's needed. And you don't pay back, you have no interest to pay back until either the house is sold or you pass away. And the only costs you have with these mortgages are you must continue to pay your real estate taxes and your home insurance. So it's definitely options to think about. And the home care cost, you're asked, how much do you actually pay if in private pay? Well, I'll give you a range. These days, it's in the $40 an hour range. Or if you do a live-in, it's possible that if the caregiver can get enough sleep, you only will pay a daily rate, which is in the $400 a day range, which is a lot cheaper than paying for 24 hours on an hourly rate of $40. So it's definitely a consideration to think about when you're ready for home care. Now let's move on to how do you find a provider? You're ready, you've agreed it's something that you want to do, but there are a lot of services that will help you find aides or agencies that provide it. The Home Care Association of America has local chapters in New York and New Jersey, and you can go there and they can refer agencies that are on their list of perhaps with ALS. The Area Council on Aging obviously they have a general description of agencies. And of course, the ALS United Greater New York. That's where I've gotten some of my clients from, and they know the agencies that have trained caregivers for ALS, and they can recommend agencies. There are some other big organizations. Caring.com is a big website that has agencies that are rated, and they will list agencies in your town that can provide home care. Agingcare.com and A Place for Mom are the same organization, and they also have agencies they can recommend in your town and for your specific needs. For those who are veterans, as I mentioned earlier, the Veterans Administration will cover some of the care for either the person with ALS or the spouse, if one of them were veterans. It's not a lot of hours generally, but it is something. So it's definitely worthwhile looking at. The other thing is hospice. Hospice is sort of a term that for many years people fear using because they say, oh, you only get them when you're right near death. But the definition of hospice is that You just need to have a prescription that you have 6 months or less to live. And that's not a hard and true definition, because I've had some clients on hospice for 2 to 3 years, and people also that go on and off hospice as their medical conditions change. So I highly recommend hospice. Most agencies work closely with hospice, and where hospice will provide an aide and a nurse and a doctor, they will work closely with the agency on the other hours that they have. And they also provide great care near the end of life for comfort care and also for grief after the passing has happened. And the family support is often very important. Okay, now you've gotten to the situation. Now you're getting your whole family together and you want to talk about what we're doing next as far as home care. You want to make sure everyone is involved. So you have to ask questions and be patient. And discussing this openly and honestly helps everybody feel in control of the situation and better prepared as care needs change, as you know they will with ALS. You have to involve the right people. If you have siblings and it's a big family that is somewhat involved, make sure everyone's on the same page. I've had situations where there's been 3 children and one child is the one who basically takes care of the family member. The other 2 don't live close by, and they chime in and give their opinions, which are also very different about what should be done, and maybe don't even participate financially. So you have to get together with all of them, make sure everybody's on the same page, and you don't want to do this and have any disputes in front of the patient with ALS. Be compassionate, empathetic. Most importantly, reassure your loved ones that you will be there to support them as their care needs change. And that's basically my whole presentation. I would love to answer any questions that you have. And Melissa, can you take over here and start us off?
Yep, I do have some questions in the chat. So let me switch here. Someone wants to know, is there a minimum number of hours to receive care through your agency per week?
Yeah, through every agency is differently. Our agency, we have 4 hours minimum for 3 days a week. And the reason we do that is there's a great shortage of great caregivers right now. And a lot of them want to work 8 hours a day. So we give them 4 hours, let's say in the morning, and 4 hours in the afternoon. And that works for our minimum then. Other
Nice.
agencies have different things. I know some agencies that have 3 hours and 2 hours, but they'll charge a lot more per hour for the shorter shifts if they can get a caregiver to do that.
Great. And going back to your poll that you asked, the population that is participating today, we have about 7 people who answered who are diagnosed with ALS. We have 15 people who are caregiver of a person with ALS. And also we have 8 people that just wanted to learn about caregiving with someone who has ALS. Another questions I have, question. Let's see. Someone said, the monitors, life alert, do they work when they're on the cell system, when there's like a low cell phone signal area?
If you're in a rural area, you're right. It might be a problem. You're right. These are all being tested, though. What you do is when you have one come to your home, they are immediately tested to see if it really works or not. And you look at the cell service. I haven't found many places they don't work, because these days cell service, even the roaming, works most places.
Yeah. Do you have any specific companies that you recommend?
Well, we use one, the one I showed you on the diagram. It's called Direct Link. And it's a very good service. And they also, as I mentioned earlier, they have, in addition to the device I showed you, you wear around your neck, they have sensors in the home for people living alone that if there's no movement for a certain number of hours, the other family members will be notified, and that's all voice activated, and they can actually speak to the person in the home saying, are you okay? We haven't seen you get out of bed yet today. What's happening? So that's something for someone living alone that is having problems with mobility. These devices are pretty good, and Direct Link is good. You know, there's Life Alert that everybody uses. That's the famous one, but their service is doubtful. I just recently switched somebody from them because they just couldn't, it just didn't work. And they
Oh,
couldn't
wow.
get anybody at the service to help them out, to tell them why it didn't work, and no one would come to the home, whereas
Hmm,
Direct Link does go directly to the home.
nice. Also, do your aides have to get a special certification to use a patient power lift or Hoyer lift?
Yes, not a special certification, but that is part of our regular training.
Oh,
First, we actually have a school where we train people to become certified home health aides. And part of that training is the Hoyer lift. Now, it's something that is not that difficult to do, but it takes a lot of confidence to be able to do it because the patient is usually terrified by having it. For instance, the doctor I mentioned in my presentation, she had a Hoyer lift, and even though we had really experienced aide, she was terrified every time it went up. And you have to instill confidence in the patient that they're not going to be dropped. I mean, that's what they think. They see this thing going up and they're going to be dropped on the floor. Well, it doesn't happen that way, but you definitely need training for both the patient and the caregiver.
nice. So you also provide care in New York City? Is it the five boroughs or are you limited to Manhattan?
Yeah, well, we're not limited, but we're mostly Manhattan.
Okay, awesome. And someone else has a great question. Like, what is the best advice you would give to an ALS caregiver?
Well, what we do with our caregiver, and but by the way, just to give you an idea, the one I mentioned who took care of two of our clients, Maggie, she was so incredible because she was caring, compassionate. She had the kind of personality to get along not only with our ALS patient, but with the rest of the family. And her story of how she helped Judith get into Leonard Florence and then helped Ken, we nominated her for, we have an award called the Exceptional Caregiver Award. It's nationwide for all the home helpers office. And she won it. And it was, she deserved to win it because that was above and beyond the call of duty, driving our patient to Boston a number of times, visiting her, and then being available whenever you are. I mean, it takes us a special, we hire aides that we said you have to be empathetic, caring, and compassionate. And
Yeah.
we are very careful on who we hire.
And I like how you brought up the point of, all the pros of using an agency rather than going to a private aid. Those are really, really valid points and reasons. And so if someone has long-term care insurance, does your office help submit the claims? Because I know some agencies leave it at, the family member or friend to do all the submission of the claims.
Yeah, good question. Yes, we do everything. As soon as we pick up a client that has long-term care insurance, we get a copy of their policy and we analyze it, make sure that they're going to be able to utilize all the benefits they have. And once they're approved, we do all the paperwork. What's usually required is every week an invoice has to be sent out along with care notes. What did the caregiver actually do every single day they were there? And then once that gets sent to the insurance company, we have another person in the office that follows up with the insurance company once a week to say, did you get our invoices? And when will that payment be made? Because as everyone knows, insurance companies do not like to pay out. And unless you are on top of it, it could go on for months till payment is made. So yes, we do all that paperwork.
Great. There is another question. So can your aides work with people who use a feeding tube and are unable to, feed themselves?
Oh, absolutely. Yeah. In fact, we work with a lot of end stage ALS where people can't use their hands. And we definitely do feeding, whether it's pureed food or they're also trained to do feeding tubes if it has to come to that.
Nice. That's great to know. Let's see, let me go back to the chat.
The other training too, that you just mentioned with caregivers is uh, when our caregivers are working with ALS and when they're starting with eye gaze training or so, our caregivers go with them and they're learning it too. And I think it's getting a lot more sophisticated. When 10 years ago, when I had a client, all they were doing was using signs or so, plus, minus, letters, numbers, and that's it. And say, yes, that's the letter. Now it's more sophisticated, and that's what our aides will work with too, to make sure they're taking them to the training to get it learned quickly.
Nice. Someone in the chat has a question. Does your agency accept Medicaid/Medicare for payment in full? And what does Medicaid or Medicare insurance cover for home care? I know you touched about
Yeah,
hospice.
unfortunately, Medicare doesn't cover very much. Some Medicare Advantage programs cover a little bit, but not nearly what is needed. We are not a Medicaid agency, and that was a choice that we made right at the beginning because Medicaid pays agencies very little, which means that you have to pay your aides a very little. And a lot of our aides are almost at a rate where that Medicaid that would barely cover our Medicaid rate. So there are Medicaid agencies that work with ALS, and with the client I mentioned, Judith, she did have a Medicaid agency, and the care was adequate. But unfortunately, until the government steps in, there's not a lot of help for payment.
In my previous job, I worked for MLTSS in New Jersey, and I would see those reimbursements, and they were, yeah, quite scary. Let's see here. So yeah, someone just said if you take NY Medicaid, but no, you don't. And the meal services that you had recommended, there were two. There were the Clean Eats, is that correct?
Yeah, clean, CLEENETZ kitchen.com, cleaneatskitchen.com, and silvercuisine.com.
Good.
And they're go to their websites. You can check their menus. They have incredible menus, and
Yeah,
the prices are right too. So you wonder how they can do it for those prices.
yeah, I was just looking, it was less than $10 a meal.
Yeah.
There's also mom's meals too, but they are a little high in sodium. So yeah, like you said, we have to be careful. We have more questions for you. So are there facilities similar to Leonard Florence located throughout the country?
No, I don't know of any other ones yet. I mean, that one was specifically for ALS, and it was built technologically so that everyone could be somewhat independent. And
Yeah.
that's a good question. I don't know the answer to that. I hope
So
so, but
I think only, I'll check it. I'll check out. John, if you could put your email, I can get back to you with that information. I think there might be one in New Orleans or somewhere in Louisiana, but very far and few. So yeah, someone asked if your services are out of pocket expense. Yes, right? Private pay only.
well, unless you have
Oh,
long-term
long
care
term.
insurance, and we
Yeah.
work with the VA and that kind of thing. But yes, mostly private pay.
So the VA, what's the average number of hours you've been seeing that they approve? Does it depend on the condition of the person?
Yeah, the way they work it, they have a scoring system that you will go to a VA hospital and they ask you about the 5 activities of daily living, and they give you a score on that. And based on the score, that's how many hours it comes up on the computer that you get. It's often only 10 or 11 hours, and it's not nearly what is needed. Uh, and it's only when you're near death that they may give you, could be, 25 or 30 hours a week.
Nice.
I had one client that actually got 37 hours, but he passed away within 2 weeks. And
Oh,
then, mm,
yeah. We have another question. Someone posted, she has currently Northwestern Mutual as her long-term care insurance, and they've had, her husband has had a policy since 2002. Do you know anything about them? Are they good at,
yes,
reimbursing?
yeah, they're very good. They've been around a lot, and if she bought a policy that long ago, it's probably a great policy because insurance companies, they've virtually stopped selling long-term care insurance now. I mean, unless you're in your 50s and in perfect health, it's gonna be very hard to buy a long-term insurance policy now. But back in those days, they had policies that not only paid out a large amount per day with a cost of living inflator that kept adding to it, but they also had, it went on for your lifetime. Whereas now most policies have a lifetime maximum. It could be $150,000 lifetime. Well, you can easily spend $100,000 a year in long-term care insurance. So
Yeah.
he should, have somebody look at his policy because hopefully it's a really good one.
Yeah,
A
yeah.
very good company.
I have a couple patients that, I heard, oh, I only have 170,000 allowance, so I'm gonna, do a little by little. Can your aides work on trach care?
Well, yes, they can. I mean, I haven't had too many cases like that, but I mean, they can't they can't remove them or things. They can clean them, but they would be trained. I mean, this is where I would get, more specialized training on tracheotomies.
Mhm. And I have another question. So your services, do you service Union County also?
I don't, but there is another home helpers that does.
Oh, great. Awesome. Because you're
And
basically,
sometimes we do cover Union County too. The problem always is depends where the aides live. We do have a lot of aides that live in Newark and Irvington, so Union County would not be bad for them to go to.
I read that question. Let's see. So there's another question. Someone said, my experience with home health agencies has been the direct opposite of what Doug has described. Who can help me navigate the local agencies? Can I contact Doug directly? Yes, on the screen, Doug, right? You have your email
Yep,
and your phone
yep,
number.
yep. No, I'd be happy to talk to anyone. No, unfortunately, you have to pick the right agency and make sure, what we do is if after we have an initial assessment, we go out and meet the family and get to know them a bit and they get to know us. And then based on their needs, we pick a caregiver that we think would work and we go out and introduce them to the client. And if they like them, which hopefully we made a good choice, then we'll start. If after a few days they find there's some personality problem or whatever it is, and they want to change, well, they can be changed. I mean, we just like everybody to give a person a fair chance.
Perfect.
And
I'm
this works
sending.
particularly with clients with dementia who we often have problems there because they can't really evaluate how good an aid is.
And we have a comment about the VA question that we had before. So the VA hours vary by region. In our New York City area, it starts at 16 hours and up to 48 hours for tier 2 level for ALS patients. Our veterans that attend the Bronx VA will educate and advocate the regional VAs, and the people with ALS can now receive up to 48 hours per week if declared as level 2. Level 2 care. The agency needs to have a contract with the VA. Do you have the VA like, do you service any Bronx VA patients
No,
or?
I don't. We have basically VA clients in New Jersey, and unfortunately, New Jersey is not as liberal as New York.
Oh, okay. And then Home Helpers, is it a franchise business?
Yes,
Yes.
we have over 300 franchisees around the country.
Awesome. Any last minute questions or comments in the chat? I'm just looking before our session ends. Even with like LTSS in New York, when it comes to that with home care hours, you know, if a person's Medicaid, you know, or Medicaid recipient, New Jersey does not give as many hours as New York does. Okay, and another question, are all the franchisees equally qualified for ALS? Do you know?
I don't know that answer. I don't think so, but I would hope that they have the same commitment and passion as I have, so they will learn about it. I mean, as I mentioned earlier, Debbie Schlossberg came out and trained our aides. Well, that I'm sure somebody in your local chapter or wherever the Home Helpers is will do that also.
Nice. I'm just reading someone's email, LEVINEA okay. All right, any other questions, ladies and gentlemen? And then for the person with the facility question, I will be researching it and getting some answers back to you via email. Thank you for giving me. All righty. Thank you all. Thank you, John. Sorry. Thank you, Doug, so much for spending time with us this morning, giving us
thank
a
you.
wealth of information, and looking forward to collaborating with you more often.
Thank you. Thank you, everybody.